Our lecture is about sterilization in operative dentistry. This defines sterilization. It's the use of any physical or chemical means to remove, eliminate, kill any form of microbial flora, including the bacterial spores. While disinfection is a process of using any chemical or physical means that will cause destruction of the pathogen or any microbial flora, but it doesn't kill the bacterial spores. So disinfection is less lethal than sterilization. There are several methods for sterilization. The most common method that is used in sterilization we will discuss in this lecture. First, autoclave, US temperature sterilization, chemical vapor pressure sterilization or chemiclave, dry heat sterilization with hot air oven, ethylene oxide sterilization, and hydrogen peroxide plasma. أول وأهم وسيلة sterilization that should be available in all dental clinic is autoclave اللي هو نفسه الستين pressure sterilization. إذا عندنا light load of instrument قليلة أو مفرطة، درجة الحرارة نخليها على 121 درجة سليزية، والوقت ربع ساعة والضغط 15 PSI. إذا عندنا wrapped instrument مغلفة، نقدر نقلل الوقت إلى 3 دقائق، temperature 134 سليزية، ضغط 20 PSI. The time required for the sterilizer to reach the correct temperature is not included. هاي معناها الوقت اللي يستغرقه الجهاز التعقيم أو الأوتوكليف حتى يوصل إلى درجة الحرارة المطلوبة، هذا الوقت اللي قبله هو ما محسوب ضمن الوقت مال الستيرلايزيشن. Advantage of autoclave. الأوتوكليف used the sterilization of cloth surgical packs and towel packs، الأشياء المصنوعة من الأقمشة، also trays and paper bagged instruments. It will have a good penetration، يخترق كل السيرفيسز، يعقم all the surfaces. أيضا short procedure time و easily monitored و economical، اقتصادي. The disadvantage of autoclave is that any instrument that is sensitive to elevated temperature cannot be autoclaved. Also, any carbon steel instrument and bears tends to be rusty. Danger. The autoclave. أيضا it will cause corrosion to the neck shank portion of the diamond instruments and carbide bears. So corrosion للأدوات. Also it make the unprotected cutting edges of the instrument become dull. The second way of sterilization is the chemiclave أو chemical vapor pressure sterilization. It operates at 131 درجة سليزية، البريشر 20 PSI لمدة نصف ساعة. They must be used with a prescribed chemical by the manufacturer. The advantage of chemiclave is that any carbon, steel, and other corrosion-sensitive bears, instruments, pliers can be sterilized without rust or corrosion. While the disadvantage of chemiclaves that any instrument that is sensitive to elevated temperature can be damaged. Also, the instruments must be lightly packed in bags obtained from the manufacturer. Towels and the heavy cloth wrapping of surgical instruments may not be well penetrated by this type of sterilization. The third type of sterilization is dry heat sterilization أو هو conventional hot air oven. درجة الحرارة temperature 160 درجة سليزية for 1 to 2 hours. It should be fitted with the fans for even distribution of hot air. حتى يتوزع الهواء الحار لازم تكون بمراوح. conventional dry heat oven have heated chambers to allow the air to circulate by the gravity flow. الانسترومنت من نحطها بالأوفن should be apart by 1 centimeter to allow the air to circulate حتى يصير penetration لكل الانسترومنت. The advantage of a dry heat or a hot air oven is that all carbon steel instrument bears can be sterilized without any rust or corrosion, but it should be dried well before processing. Rapid cycles نقدر نسرعها at high temperature, economical and easily monitored. Disadvantage of dry heat is that the heat sensitive instruments such as rubber or plastic goods may be damaged by the high temperature. Sterilization cycles are prolonged at a lower temperature. The heavy loads of instruments, crowding of the packs, والheavy wrapping كله يعيق sterilization. Also, the hot air is a bad conductor للحرارة, but it does not cause good penetration for all the surfaces of the instruments. Ethylene oxide sterilization. It is the gentlest method for sterilizing complex instruments and delicate materials like handpieces. Also, it's less expensive. Sterilization يكون at room temperature, but overnight. The device operates overnight. Units with large chamber sizes hold more instruments or packs per cycle. Disadvantage of ethylene oxide sterilization that it is mutagenic and carcinogenic. Also, it requires aeration chambers تهوية where the cycle time lasts hours. يعني ياخذ وقت طويل sterilization. Hydrogen peroxide plasma. This type of sterilization used to sterilize temperature-sensitive devices or materials. درجة الحرارة 37 إلى 44 درجة سليزية والتايم هو 75 minutes. No need for aeration، ما يحتاج تهوية because it is dry و non-thermal process and there is no toxic byproducts. أكو new methods of sterilization كلها under investigation and development، مثلا ozone, peroxide vapor, ultraviolet light, gamma radiation and so on. Liquid sterilants, high-level disinfectants. The sterilant that is used in high-level disinfection is the glutaraldehyde at 2 to 3% concentration. It will kill bacterial spores in 6 to 10 hours. Greater dilutions are not encouraged for repeated use. Also, placing wet items in the disinfectant tray will cause dilution to the solution. The glutaraldehyde is toxic material. It may cause irritation, sensitivity to the skin and respiratory passages. It should be placed in a well-vented area. The 2% glutaraldehyde solution is not used to wipe the dental unit and chair. Vaccines for dental health care workers. Dental health care workers are deal with blood and saliva, which is regarded as the greatest transmitter of disease. So all should be vaccinated against hepatitis B virus, influenza viruses, H5N1, H1N1, measles, mumps, rubella, tetanus, and others. All dental health care workers should wash their hands with soap and water before wearing gloves and after wearing gloves, before treating each patient and after touching of objects likely to be contaminated by blood, saliva, or any respiratory secretion. Sterilization or disinfection of instruments. All instruments should be cleaned thoroughly with soap and water or any detergent solution to remove all debris. The person involved in cleaning the instrument should wear a heavy-duty gloves to decrease the risk of hand injuries. All the instruments after use should be placed in water or any disinfectant solution to prevent drying of the instrument and to make the cleaning more easier. All critical and semi-critical dental instruments that are heat stable should be sterilized by any type of sterilization method that is suitable for that instrument, such as by autoclave or dry heat or chemiclave, while critical and semi-critical instruments that will not be used immediately can be packed before sterilization. Now we have to know what do we mean by critical instruments. الcritical instruments هي الانسترومنت that penetrate the soft tissue or become in contact with bone or enters the bloodstream, such as surgical instruments, periodontal scalers, scalpel blades, surgical dental burrs. The semi-critical instruments is the instrument that becomes in contact with mucous membrane or in contact with non-intact skin, such as the dental mirror, the amalgam condenser, the impression trays, والdental handpieces. These are the categories: critical, semi-critical, and non-critical instruments. A non-critical instrument that become in contact with intact skin, such as a radiograph head, cone, blood pressure cuff, and face bone. Critical and semi-critical previously explained. Cleaning and disinfection of dental units and environmental surfaces. After completion of each patient treatment, all the dental unit surfaces should be cleaned using disposable towels and any cleaning agent and water. After cleaning, all surfaces should be disinfected using any chemical germicide, such as sodium hypochlorite, which is inexpensive and effective germicide. It should be in concentration 1/4 cup of bleach to 1 gallon of water. هذا التخفيف مالته. But the caution should be taken because the chlorine is corrosive to metal, especially aluminum. Disinfection of the dental laboratory materials such as impression, bite registration, fixed and removable prostheses, orthodontic appliances should be cleaned and disinfected before being manipulated in the lab and before placement in the patient's mouth. All the high-speed dental handpieces, low-speed handpieces components that is used intraorally, and other reusable prophylaxis angles should be cleaned, lubricated, sterilized according to the manufacturer instruction before and between patient use. Needles, scalpels, disposal of waste materials. Disposable needles, scalpels, and other sharp items should be placed into an intact, puncture-resistant containers before disposal. Also, solid waste contaminated with blood or other body fluids should be placed in a sealed bags to prevent leakage of the container. Thanks for listening.